South Korea's health ministry has reported an addition to the death toll of Middle East respiratory syndrome outbreak in the country. Tell us why, Eric Ferrer.
South Korea's health ministry on Wednesday, June 10, said 2 more people died in its Middle East respiratory syndrome or MERS outbreak and reported 13 new cases, taking the total to 108. The 2 deaths, both cancer patients, brought the number of fatalities to 9. The ministry said all of those who died had been suffering serious ailments before they were tested positive for the MERS virus. The 13 new cases were all linked to hospitals. Meanwhile, a quarantine tent was set up for suspected cases of MERS outside Seoul National University Hospital. Suspected MERS patients were required to get a health checkup in the tent, which has been set up in front of the hospital building on May 31. Medical workers from the Korea Centers for Disease Control and Prevention wore protective clothing as they stood outside Samsung Medical Center with a suspected MERS patient. The nation's health minister said that the Samsung Medical Center has recorded 37 MERS cases and 2 deaths. South Korea's infections have all been traced to a man who developed MERS after returning from a trip to the Middle East in early May, and who came into contact with other patients at the hospital before being diagnosed. South Korea's new cases bring the total number of MERS cases globally to 1,257 based on World Health Organization's data, with at least 448 related deaths. The country has the second highest number of cases after Saudi Arabia, according to the European Center for Disease Prevention and Control. From Seoul, South Korea, Eric Ferrer, reporting for Y News.